Today we're talking about SculpSure. It's our new non-invasive body contouring device that we're very excited to have. It uses 1060 nanometer diode laser to penetrate the skin and actually lyse and damage the fat cells, which the body subsequently clears out with its own mechanisms. There's been a lot of other non-invasive body contouring devices. Many of them use cold therapy or radiofrequency therapy, and none of those were very effective in my opinion. They would work on some people, but not as many, and there were also a lot of limitations on who you could use it on. And in addition, they had to have enough loose skin to be able to pull it into the cool sculpting type device. And the radiofrequency lasers really hurt. We tested them a few times and they hurt a lot. So the advantage here, anywhere that we can get a flat surface, which is many more areas than those other machines, we can apply these applicators that penetrate through the skin, and the laser specifically targets the fat. It does not damage the skin and makes the fat bust and rupture, and then the body clears that out. It's a very simple process, not very painful. It takes about 25 minutes, and we're going to go ahead and do one now. So the first thing we're going to do is figure out which area we're going to treat. And today we're going to treat the upper abdomen of this patient, and we figure out how many applicators or squares that we need. And we've already determined that she needs 3 of these. Okay? So then all I do is I put this on with a simple belt. I'm going to put this in place and snug it down. I'm going to make sure we have good contact and that it's touching. Any flat surface, so very good areas of the upper abdomen, the lower abdomen, the flanks, the thighs, the back, many, many places. You can also do the arms. So then we take this, and we're going to wet the skin a little bit with a special spray. Just kind of wipe the skin. It's just a skin protectant. It also helps us get a better seal. There's no pain to any of that. Then we're going to take our device, and I've decided she needs 3 applicators. The machine can do up to 4 at a time. And we just literally just pop these into place. So that's 1. 2. And the green light means that we have good contact. 3. Okay? So once that's in place, we're going to talk to our patient a little bit and tell her 2 things. One is, this guide kind of tells us what we're looking for. And what we're looking for is a moderate warmth. It starts to be a little bit on the edge, and then but not actually hurting. Okay? And we're going to tell her to help us get that level. We're also going to give her this device that can let us know if she's starting to have too much burning, and it will turn the machine down and let us know. So I'm going to put this where she comfortably can hold it with her hand. We also will frequently give them an iPad or something to entertain themselves with. And then we're going to turn the machine on. So to turn the machine on, we check our settings, and we turn this on. And it's going to warm up. And as it warms, I'm going to continue to talk with her and make sure that we're kind of getting, we call it 4 levels of warmth. And when we get to the 4th level, that's perfect. And then the treatment will persist for 25 minutes. And it's a series of getting warm and then a cooling session in between to give the skin a break. And it's not going to hurt, it's just going to get a little warm and prickly heat. All right, so our treatment is now done. It was 25 minutes. She tolerated it very well. And then we simply are going to take these devices, pop it loose, and put it back in the machine. She'll have a little redness on her skin from the treatment. Disconnect this. Clean her off. And we're done. She doesn't have to wear any compression. She can go immediately back to her everyday normal activities today. And the body, you drink a lot of water, and that helps flush the system. And over the next 6 to 10 weeks, the fat cells that were just killed will be washed out by her body. And that's it.